Hello, my name is Sierra, and today I will be talking about the risks of playing high school sports. So, the first topic I will be talking about is the types of sports injuries, which are injuries to the muscles, the bones, ligaments, which are the thick bands of tissue that connect bone to one another, the tendons, which are the tough rubbery cords that connect muscles to bones, the joints, which are the hips, the elbows, the ankles, and the knees, and at the cartilage, which are the tough, flexible tissue that covers the surface of joints and allows bones to slide over one another. So, how injuries can occur? They can be sudden on onset, which these are often the result of a sudden impact or an awkward movement. So, like in soccer, women are more likely to tear their ACLs because the hamstrings are weaker than the quads, and so if they do a cut and they plant wrong, that's usually how a woman will typically tear their ACL. It's a non-contact injury. So, some others are sprains, and sometimes more serious injuries are at risk. Sudden injuries are accidental but are less likely to occur if you are fit, you know your sport, you wear corrective footwear and protective equipment, or exercise in a sensible way. The next way an injury can happen is gradual, which this is a result of overusing the particular part of the body, sometimes poor technique. Overuse injuries are common in professional athletes due to their intense training of nature. So other types of sports injuries are stress fractures. These are common sports injuries. The bone breaks, but can also be thought of as a crack. It's a full thickness crack rather than a complete bone break in which the bone is in two separate pieces. This is a result from sudden increase in training intensity or quantity, a change of sports surface, or change of running shoes. So a lot of the times cross-country runners will have a stress fracture in their foot or in their shins due to the different trails and running surfaces that they run on when they're transitioning from cross and into track. That's a lot of the times when you can see those stress fractures occur. So, other injuries or pain that can happen due to sports is at the foot and the heel. One common condition is plantar fasciitis, and plantar fascia is a thick band of tissue stretching under the foot. Ingrown toenails is common in runners because the toes can become worn and swollen and tight in our training shoes. Other joint pains and injuries that can occur are at the ankle. Achilles tendon is a strong tendon which connects the muscles of the calf to the heel, and a lot of the times you can see that the tendon either ruptured, it can occur partially or completely, and this usually happens because of overstretching of the tendon. Ankle sprain and ankle fractures are most commonly caused by twisting injuries when running or jumping. It takes considerable force to actually break the ankle. So a lot of the times you can see athletes as they jump up and as they land, the ankle will twist, and that is the result from poor landing mechanisms, which we work on to decrease that risk. Other pains and injuries can happen at the lower leg. Shin splints, which is a term in the shin bone relating to exercise. It occurs when the edge of the shin bone becomes inflamed due to the muscles and tendons pulling on it during exercise. This often happens after running or jumping or sports with sudden stops and starts such as basketball or football. Sudden increases in running distance or pace can also trigger it. Shin splints can sometimes form mini stress fractures, cracking the bone, and these may occur after landing with particular force and can be extremely painful. And most of the times, to reduce the pain from shin splints, we'll have the athletes rest. Knee and thigh pain are also common throughout sports. Injuries to the knee and the thigh are particularly common, like I had just previously stated, in football, which involves running and twisting. Some of the results in that can happen because of flat feet, the wrong shoes, weak ankles, weak muscles, lack of fitness, and just having joints which are more flexible than usual. Quadricep strains are injury to the bulky muscles at the front of the thigh. It can occur suddenly, in which it is usually painful and obvious, or through overuse. The ACL, which we had talked about earlier, is in the knee. Hypermobility can also cause anterior knee pain on its own, especially over time when young people have increases in growth spurts. So these are quite a few of the injuries and the risks of playing high school sports, and we just wanted you as parents to be aware of all the possibilities of having your child participate. Thank you.